Hi everybody, my name is Elizabeth Lopez and my partner is Paige Mitchell, and we would like to present to you today with our research proposal on cognitive behavioral therapy and domestic violence exposure in boys. In our research proposal, we would like to focus on using trauma-focused cognitive behavioral therapy to reduce the effects of parental domestic violence exposure in adolescent males and preventing future intimate partner violence. In prior research, they would normally focus on children, helping them recover from PTSD symptoms. And they would also focus on young girls and helping them reduce the risk of intimate partner violence in their own relationships. Every year, more and more children are exposed to parental domestic violence, and that is why it is so important to social work, because those children usually end up displaying violent and aggressive behaviors and have a high risk of experiencing IPV as either victims or perpetrators in the future. Young girls are more likely to become victims of IPV, and while providing them with CBT can be beneficial, providing CBT to young boys can decrease the likelihood of them becoming perpetrators, thus reducing the risk of young girls becoming victims of IPV. So for our research question, we are wanting to know, does trauma-focused cognitive behavioral therapy for the effects of domestic violence exposure reduce the likelihood of future intimate partner violence in adolescent males? So what we hypothesize is that if trauma-focused cognitive behavioral therapy reduces the effects of domestic partner violence exposure in adolescent males, then the likelihood of partaking in intimate partner violence in the future will also decrease. So for our independent variable, we are looking at intimate partner violence in relationships of adolescent males. And for our dependent variable, we are looking at trauma-focused cognitive behavioral therapy. And so what we're hoping for the outcome of the study is the reduction in the effects of parental domestic violence exposure due to CBT. So the type of study for our research proposal we are looking to do is evaluative research, because we are looking to see if trauma-focused cognitive behavioral therapy will help reduce the effects of exposure to domestic violence in adolescent males, and then if it will eventually reduce the chance of the males becoming IPV perpetrators themselves. The study design of this proposal is experimental research. Experimental research normally contains a control group and an experimental group. So our control group will be receiving traditional therapy, and the experimental group will receive the trauma-focused cognitive behavioral therapy.
Sampling. For this research study, we're interested in adolescent males between the ages of 10 to 17. The best sampling method for this research is going to be random sampling. Within the sample, we will randomly assign the research participants to either the control group or the experiment group. And then for obtaining the sample, the first step will be getting participant referrals, and we'll get those referrals from the Division of Family Violence at the local police department, local schools, and domestic violence shelters. And then for the next step, the participants will randomly be assigned into a control group, and that's going to be traditional therapy, and then there will also be an experiment group that participants will be assigned to, and that will be trauma-focused cognitive behavioral therapy. Measurement. So the methods of measurement that we'll be using, there are quite a few of them, and we'll start off with 2 pretest questionnaires, and these pretest questionnaires will look at the behaviors that are needing to be addressed during therapy, and we'll have the non-offending guardian filling out and the adolescent male filling out, and this will kind of provide an outside look and an inside look at the behaviors that are happening. And then we'll also do in-person interviews, which will be conducted at the beginning of treatment, the end of treatment, and at a 6-month follow-up. So having them at the beginning of the treatment for the non-offending guardian and the research participant will help us learn more about the participant, how they're feeling, and what they're expecting of this research study and the therapy and everything. And then we'll also have another in-person interview at the end of treatment for the non-offending guardian and research participant again to learn about the changes that have been seen over the course of the therapy. And then we'll have the last in-person interview, which will be conducted at 6 months after therapy has ended, and this will just be follow-up on the behaviors with the non-offending guardian and the research participant. And then we'll move on to phone interviews, which will be conducted at 12 months and 18 months to also learn more about the behaviors that are happening and how they've changed, if they've come back, and everything like that. And then we'll do these with the non-offending guardian and the research participant as well, as long as the research participant hasn't turned 18 during this time. So if they've turned 18, then we don't necessarily need to talk to the non-offending guardian anymore. And then we'll also have survey questions, which will be done at the beginning of treatment, at the end of treatment, and at every follow-up to see how they're liking the study and how everything's going. And then the 12-month and 18-month surveys will be emailed, so we may not get all the responses for that. And then limitations. So the limitations of this study, the first one is the study will not be long enough to get a good idea if the cognitive behavioral therapy is effective, especially because the sampling will include boys as young as 10 years old. So we probably won't see if they end up becoming perpetrators or victims of intimate partner violence in the future. And then it's also kind of a broad research question, so we may need to look more specifically into cognitive behavioral therapy reducing one type of effect of exposure to parental domestic violence in adolescent boys. And then also there's the risk of participants dropping out of the study, which can happen with any study, but especially with this one because of the maturity level. And the maturity level also falls under the survey questions and all the different interviews and everything like that not being taken seriously due to the age of the participants. And then for conclusions, the possible findings are we believe that we'll see an improvement not only in the symptoms that are caused by exposure to parental domestic violence, but we'll also see a noticeable reduction in the display of violent behavior, mental health issues, and all of the other effects that come along with being exposed to domestic violence. And then the importance of findings for social work. This research will give social workers a better idea of what type of therapy will most benefit young male victims of exposure to parental domestic violence. And then if we don't find what has been hypothesized, so if we don't find that cognitive behavioral therapy is helping, then the research question may need to be more specific, or other therapies can be explored. And then we would also need to analyze the results and see if any of the behaviors were reduced as a result of cognitive behavioral therapy, because then we could make our research question more specific to ones that maybe weren't reduced. But yeah, thank you for listening to our presentation about cognitive behavioral therapy reducing the effects of exposure to domestic violence in adolescent males.